Increasing hospitalizations are still a major concern to healthcare workers across the state. Fewer than 1 in 5 hospital beds are available statewide. The field hospital at State Fair Park has accepted a new patient nearly each day this week. Healthcare providers there are now treating 7 people.
All but 4 of Wisconsin's 72 counties have very high levels of COVID right now. For rural hospitals with less resources, space, and staff, those statewide numbers are more than troubling. We checked in with some of your hometown hospitals to see how they're keeping their patients and their staff safe. That community feel. Any small town born and bred will tell you.
Ever since I was a little girl.
It's almost ingrained.
Since the age of 5.
Indispensable to our way of living.
There's just nothing else I would rather do. You guys need...
Community is why Nicole Vondra picked a career in nursing. Helping neighbors is her passion.
In our relationship with our patients and taking care of our neighbors and our family and friends and their children is just very important to me.
Close-knit also comes in handy during a COVID pandemic, both for hometowns and hospitals.
I have been so proud to be part of this organization.
Nicole and nurses across 2/3 of the state are dealing with a stark increase in patients. DHS data shows South Central Wisconsin has seen a 42% jump in hospitalizations over the past 2 weeks, but that includes bigger counties like Dane and Rock. Tracking those numbers at rural hospitals like those in the 3 most southwestern counties of the state is harder because patients are often transferred to bigger hospitals. But public health officials in Grant, Lafayette, and Iowa counties all confirm a definite uptick.
We are admitting an increased number of COVID-positive patients as well as seeing them in our emergency department.
Iowa County's lone hospital, Upland Hills Health in Dodgeville, is seeing its highest number of patients since the pandemic began, though it's far from full. The hospital has 9 COVID-designated rooms, 3 of which are for intensive care patients. At most, staff have filled 4.
Well, this is something that we have to monitor closely every day and throughout the day because it changes. You may start the day with only 1 bed filled, but then you discharge 3. So now you've got, 4 beds open.
Farther west, Grant County is harder hit.
My fear since this happened has been the whole staff.
Grant Regional Health Center in Lancaster has 6 negative pressure rooms for COVID patients, 2 of which are in use right now, so they're doing okay. A big concern, though, is if staff get sick.
We're a small organization. You take 2 or 3 staff out of one department. We're in staff crisis mode and got to figure that out.
The team there reinstated its incident command team to monitor county case numbers and put together contingency plans for any future staff shortages.
We have a comprehensive plan for the entire organization where we would shift people to if necessary.
As for the people they serve, both these hospitals use a statewide system that updates available hospital beds on a daily basis, so patients can be transferred if any one system is overwhelmed. A neighborly network of hospitals, if you will. In fact, Upland Hills offered to do just that for a clinic in the Fox Valley when its beds were full.
I think it's important that the community knows that we're feeling very well prepared and very capable.
Still, it's become harder to find open beds across the state, and the stress on staff is very real as they navigate a new normal together.
It's not perfect, and there's been challenging days, and we've been lucky, I would say, and it is luck in a lot of ways.
Which is where that community part comes in handy.
We are all in this together, and that's the thing. We are helping each other out.
So one big message from both of these hospitals is these are safe spaces, staffed with people who are prepared to take care of you, whether it's for a COVID diagnosis or something else. They're also stressing don't put off care. Delaying a trip to the hospital for whatever's ailing you could make that sickness much worse. Now, another big question is how hospitals are doing on PPE to keep their staff safe. Upland Hills sitting pretty good right now. They showed us their stock of 16,095 masks on site. As for how they hand those out to staff, it varies depending on the department. Generally, though, if a staff member is dealing with a COVID patient, they change out their mask every shift. Then, further west in Grant County, we checked in with Grant Regional Health Center in Lancaster to talk about their burn calculator. This is something all hospitals use to keep an eye on their weekly use and whether it's on the rise.
I think we feel now we're okay. Doesn't mean in 2 weeks when we get a lot more patients, we won't be reaching out to other areas to try to find it.
Now, something Else, hospitals have to factor in the supply chain. Over the last 6 or so months, it's been pretty erratic, so conserving all PPE right now is still important. But there is a contingency plan in place. Emergency management departments across the state are tasked with keeping an eye on the 14-day supply of PPE in their county and making sure their hospitals have enough. So if any clinic gets low, their local emergency management team would step in to keep them supplied.